And before we move on to after undergrad, were there any takeaways that you wanted to share?
From the internship?
Internship or just like entire undergrad experience?
Yeah, I think my main takeaway would be I know there's a lot of pressure. I'm thinking of individuals who might be, if not already in undergrad or in undergrad and trying to figure out their next step. I think, as you've heard from my path, I started in one place and ended up somewhere a little bit different. Sometimes people know exactly what they want to do and go on to pursue a master's in it. Sometimes people don't, and that's totally fine. And I think that's my biggest takeaway is the way that I was able to narrow that down was being involved in things like internships, talking to people on campus, talking to my professors, and then finding out sort of what the long term path could look like. And I think that I would encourage people at any point, if you're even having a career change or anything going on in your life, that you just stay open to all the opportunities and soak it up, and it will lead you to the next thing that's right for you.
That's a great point as well, because a lot of people come into public health not really know where they want to go. And I think it is up to the experiences and the conversation that you're having with people, as well as using LinkedIn and other resources to just kind of figure out what is it that I like, what is like the career trajectory for someone doing this kind of work, and how can I do that kind of work or get experience so I can be a strong candidate for those types of roles after graduation. So that's awesome. So you, after undergrad, you decided to get a Master's of Science in Public Health Communication for Social Change at CUNY Graduate School of Public Health and Health Policy. Can you tell us about that? It is, it is. Can you tell us about that thought process, and maybe even like, okay, so because you said you went into undergrad as a nutrition, dietetics interest, then you were taking some health classes, switched over to public health as your school had that major, you were able to do this research, this internship, and like work with the community. You graduated. Did you know that you wanted to do a master's degree? Why Masters of Science in Public Health? Were you thinking a Masters of Public Health? Tell us about all of that.
Sure. Yeah. In public health, at least in New York City, New York State, you almost always need a master's. At least from all the jobs that I had seen, I remember when I was looking when I was in undergrad and sort of thinking about my long-term career. So a master's was almost guaranteed. There wasn't a question about it. I took 6 months or so in between undergrad and my master's. So I sort of, pretty much immediately went into it. There wasn't a huge gap. I'm noticing that there's a trend here in my path. But when I started at CUNY graduate school, I was on the community health track. So there was only a couple of tracks, and community health seemed to most closely align with what I was already doing and was focused on community-based work and that type of approach to public health. Some of the other tracks were more epi, biostats, health policy, and management, but and I believe environmental science. But the community health was the track that I found myself perfectly sort of aligned with my long-term goals. But then similarly, a few months into my master's program, which luckily at the very beginning, you're doing a lot of the core classes. So a lot of things were similar across all of the different concentrations. There was a new program, the Masters of Science for Public Health Communications and Social Change, that was introduced. It was it's so funny. The web page wasn't even up yet, wasn't even completed when I saw it, but it was posted. I saw it. There was an email for a professor on there. I reached out and I was like, hey, what is this thing? I'd like to learn more about it. And then, yeah, I went from the community health track into communications because I thought it was such a unique and different type of role where communicating is such a big part of public health. It's really fundamental and core to everything that we do, whether it's in the, whether you're doing community health education, or you're writing papers for publication. There's a fundamental level of health education that health communication that has to take place to be able to really make meaningful change. So that's really where I found that track. And I also was rebelling a little bit from all of the MPHs, because also in my region, MPHs have become very popular, very trendy. And not that they're still not valuable, of course they are, but I thought that this was kind of positioning me a little bit more on a applied sciences a little bit, because I had all of this, my bachelor's was in public health, and I thought, okay, let me do a master's in something slightly different, just to round out my knowledge and education. And so, yeah, that's essentially why I went that path. And I think also it was all new information. I felt like oftentimes I know graduate programs build on a lot of the basics that we learn through undergraduate programs, but I found that a lot of the information some of it, of course, was fundamental things that we've learned and built on that, but there were also whole new concepts and things that I use to this day in my work.
I love that, I'm glad that you're able to talk to like that transition of thinking about like community health work and then switching across this communications, and like why that was a big part for you, as well as like looking at the landscape of where you wanted to work, where you wanted to live in New York, and saying, okay, everyone has a master's, everyone also has a master's of public health. I already have a bachelor's of public health. Let me think about like how are things that I can like differentiate myself and maybe build skill sets that other people do not necessarily have. So I love that perspective, and I think that's a good framework for other people as they're thinking through like what do I get my master's in, or like how do I think about where I want to end up in the field. So that's good.